to prepare for it today. In my national address on April 25th, I outlined how we will move beyond the pandemic and into a future where restrictions are ended and our lives here in Bermuda return to normal. To prepare for that future and ultimately get there requires us to work together to eliminate local transmission of the coronavirus, maintain strong protections at our borders to keep dangerous variants out, and continue to progress with our vaccination program. Due to our collective efforts, we have seen our positive case numbers steadily decrease and local transmission begin to significantly slow. As the Minister of Health will outline shortly, we are just about at 50% of our entire population being fully immunized, and we have already implemented stronger protections at our borders, which will be strengthened in the coming weeks. We are doing what is necessary today for a normal future tomorrow. In addition to the work that we are already doing, there is a need to stay one step ahead of the virus and do what we can to support local businesses, Bermudian workers, event promoters, and provide ourselves with the ability to hold important family and cultural events that we have been without for so long. Through technology, we can do this. And tonight, I'll provide details of the Safe Key program that will allow us to reclaim our summer and our island while keeping all of us protected. I am joined tonight by the Minister of Health, the Honorable Kim Wilson, who will provide the country with an update on the latest coronavirus test results and preview some new health guidelines. We will also be joined tonight by the Bermuda Hospitals Board Chief of Staff, Dr. Wesley Miller, who can answer any medical questions from the media or questions related to the hospital. Unfortunately, the CMO will not be with us this evening as he works nonstop and is certainly in need of rest, so we wish him well. First, we will hear from the Minister of Health. Minister?
Thank you, Premier, and good evening, everyone. The Ministry of Health received 858 test results since the last update, and 2 were positive for coronavirus. This gives us a test positivity rate of 0.2%. Both of the new cases are classified as local transmission with known contact, as they are associated with known cases. Additionally, since the last update, there were 37 recoveries and no further deaths. There are currently 136 active cases, of which 127 are under public health monitoring and 9 are in hospital, with 2 in critical care. Since since March 2020, Bermuda has recorded 2,479 total confirmed cases of COVID-19. And out of these, 2,311 persons have recovered, and sadly, 32 have passed away due to COVID-related deaths. The source of all cases is as follows: 298 are imported, 2,100 are classified as local transmission, of which 1,655 are local transmission with a known contact or source, and 445 are local transmission with an unknown contact or source, and 81 are under investigation. As investigations proceed, transmission categories may change. The 7-day average of our real-time reproduction number is less than 1. Bermuda's current WHO country status remains at community transmission. We continue to see our numbers getting better. Our number of active cases is falling and our recoveries are increasing, and this is very, very good news. But we must continue to take this pandemic seriously. We are still in community transmission with 136 active cases. Compare that with 3 months ago when we had just 8 active cases. There's still a high risk in our community that people can contract the virus. We are trying to prevent new outbreaks, and I remain concerned that if we have social gatherings and events and mixing of households, we will have more cases. So gatherings and mixing of households should be minimal if they happen at all. Similarly, while working from home is no longer mandatory, we strongly recommend that those who are able to do so continue to work from home. Community transmission of the coronavirus is real. Being disciplined in everything we do is what is going to help us. I think we are doing well, and I am confident that we can get this virus under control. We have to continue to follow the guidelines, get tested, and please speak to your physician about the vaccination. I would now like to provide an update on our vaccination program. We have completed the 18th full week of vaccinations. From January 11th to May 15th, 2021, Bermuda has registered a total of 65,497 vaccinations, and that figure rises to 66,564 if you include vaccinations administered between Sunday, May 16th, and Monday, May 17th as well. And all of this is very, very excellent news. Of the 65,497 vaccinations administered for the period that we are reporting, namely the period that ends on the 15th of May, 52% are women and 48% are men. Significant progress has been made in vaccinating our most vulnerable population, and I'm very pleased to report that. 79.9% of all residents over the age of 65 have had at least one vaccination, with 70% being fully immunized. To date, 53.9% of the population has been vaccinated with one dose, and 47.7% of the population has been fully immunized with 2 doses. We have made remarkable progress since our vaccination campaign began at the beginning of the year. The vaccine is extremely effective in preventing a severe illness or death, which we saw demonstrated through the challenging outbreak that's caused the stay-at-home regulations to be put in place in the first place. I encourage everyone who wishes to be vaccinated to speak to their doctor and do so as soon as possible. For recent travelers, the Ministry of Health guidance is being updated to support vaccination after your day 4 negative COVID-19 test result. You will no longer have to wait until the end of the day 14 period. You can get vaccinated at the Bermuda College, which is open between Monday to Friday from 9 a.m. until 1 p.m. for walk-ins. And you can also make an appointment to get vaccinated at the Bermuda College between 11 a.m. and 1 o'clock p.m. However, the Bermuda College is not open for vaccinations over the weekend. The Bermuda Hospitals Board Vaccine Center is open daily between 8 a.m. and 8 p.m. for anyone who has an appointment. This is especially convenient for people who are working during the day and who need an appointment in the evening or on the weekends. Our mobile vaccination sites are also convenient as we visit various locations around the island 3 times a week. Later this week, the mobile vaccination program will be at the following locations. On Thursday, May 20th, it will be at the Southampton Princess from 10 a.m. till 2 p.m. And on Saturday, May 23rd, it will be at TCD in Hamilton from 10 a.m. to 2 p.m. This week's mobile vaccination program will be for individuals who wish to get their first dose, as well as those who need to receive their second vaccine shot following their first dose, which they would have had 3 weeks ago. The vaccine is the most effective after you receive the second dose, so don't forget to go back to the Southampton Princess or TCD to get that all-important second shot. Next week, our mobile vaccination program will be at the following locations. On Tuesday, the 25th of May, it will be at the Open Door Christian Fellowship in St. David's from 10 a.m. to 2 p.m. And on Thursday, the 27th of May, at the Sands Secondary Middle School from 4 p.m. until 7 p.m. And on Saturday, the 29th of May, at the National Sports Center from 10 a.m. until 2 p.m. These neighborhood sites are for people who have not yet registered for the COVID vaccine, do not have access to the internet, and prefer to register in person, or who may have additional questions about the COVID-19 vaccine. There will be doctors on site to answer any questions that you have, and you don't need to have an appointment. You can just show up and roll up your sleeve. We recommend the Close to Home mobile program as an ideal opportunity to learn more for those people who want to hear about the COVID-19 vaccine from a trusted source. And please do not forget that there is also a free minibus service available to take people from their home to the mobile vaccination sites and back to their home afterwards. If you call 533-5903 between 10 a.m. and 1:30 p.m. if you need a ride to one of the mobile vaccination sites. Anyone who feels that they need a home visit for the COVID-19 vaccine, please contact vaccines@gov.bm or call the hotline at 444-2498 and select option 2, and the team will arrange a visit in the coming weeks. Since the mobile vaccination program began on the 27th of April, a total of 1,012 vaccines have been given, and this is as of May 16th, and about 90% of those injections were administered to people receiving their very first dose. Parents who are interested in having their children vaccinated are encouraged to register their appropriately aged children on gov.bm so that the Ministry of Health can gauge interest in being vaccinated. The Food and Drug Administration and Health Canada have both approved the Pfizer vaccine for children aged 12 to 15 years of age. As the Memorandum of Understanding between the Bermuda government and the Foreign Commonwealth and Development Office specifies that the vaccines can be used on people ages 16 years and older, we are still working on a resolution on this issue before we can start administering the vaccine to persons within the ages of 12 and 15 years. As Bermuda reaches a milestone of having 50% of our population immunized, which we would expect that in the coming days, I would like to announce some changes to our guidance. A number of people have asked, why aren't we following the guidance issued by the Centers for Disease Control and Infection, or the CDC, with respect to immunized persons? I can say that each country has developed its own approach in battling the coronavirus. Bermuda takes into account the information, advice, and guidance issued by trusted sources such as the World Health Organization, Public Health England, and yes, the CDC. However, we cannot blindly follow other organizations. We must take into account our own situation as we adjust and adapt to this pandemic. For example, the CDC has a quarantine period of 10 days and does not require its citizens to test out of quarantine. In Bermuda, however, we have found residents testing positive on day 8 and day 14. So we have not followed the CDC in advocating a shorter quarantine period, and we continue to require a negative test result to get out of the quarantine. Nonetheless, we are pleased to see our indicators are moving in the right direction, and we are now updating our guidance as it pertains to immunized persons. These relaxations that I'm about to speak about apply again to immunized persons only. Return to work. If you are a close contact of someone who has COVID-19, you do not need to stay away from work unless you have symptoms, but you must wear appropriate PPE, such as a mask, and you have to test at the beginning and the end of the COVID-19 incubation period. Certain workplaces, such as healthcare providers and corrections, may require a more strict application of this guidance. Number 2, mask wearing indoors. Indoor gatherings are allowed with other immunized persons, for example, those who have had 2 vaccine doses plus 2 weeks have passed, without wearing a mask being worn. However, people with medical vulnerabilities should continue to wear masks if physical distancing cannot be maintained. And 3, mask wearing outdoors. Gatherings outdoors with no mask worn are allowed except in certain crowded and high-risk settings or venues. Given that Bermuda is still in community transmission, it is important to know that key public health measures will continue to be enforced. These include having a curfew, limiting the size of gatherings and the number of people seated at a table, and most importantly, wearing a mask indoors when physically distancing cannot be achieved or the vaccination status of the people around you is unknown. I cannot overemphasize this point. After vaccination, mask wearing is the single most important public health measure that you can take. If you are not vaccinated, please continue to wear your mask. Also, before I end, I would like to address the timing of the traveler's pre-arrival test. It was announced previously that the time frame for the pre-arrival test would change from 5 days to 3 days from June 6th. We have listened to the concerns expressed about the short period of time allowed for test results to be received. Therefore, beginning on the 6th of June, the ministry will change the time frame for the pre-arrival test from 5 days to 4 days. Finally, I want to thank all of our healthcare team, our frontline workers, our testing team, case management and the contact tracers, the vaccination team, all of the people who go above and beyond the call of duty every single day. They work incredibly hard to manage this pandemic and to keep our island home safe. I also want to recognize our emergency medical service providers. This is Emergency Medical Services Week, and we pay tribute to our paramedics and emergency medical technicians for their daily efforts and service to our community. Our EMS providers deliver essential service, they risk their lives, and they also save lives. Thank you all for everything that you do, and you are all doing an amazing job. So please remember, each of us must play our part to stop the spread of the coronavirus. It is essential that we follow all of the public health guidelines. We wear a mask, we practice good hand hygiene, we maintain physical distancing, and we download the We Health Bermuda app. Do the research, talk to your doctor, and make an informed decision about getting the COVID-19 vaccine. Stay safe, Bermuda, and do not forget to avoid the 3 C's: closed spaces, crowded places, and close contact settings. Thank you.
Thank you, Minister of Health, and thanks certainly to your team at the ministry for all the continued hard work. It is very encouraging to see our vaccination numbers continue to increase, especially while seeing our active case numbers decrease. And I am also very proud of the success of our close-to-home mobile vaccination program, which has seen well over 1,000 persons vaccinated, with additional 150, in excess of 150 doses done today in the east end of the island. I thank the Bermuda Health Council and all of the doctors and nurses who are both inside the Ministry of Health, plus the volunteers who come to make this program a success, as well as ensuring that it is informative by being on hand to answer any questions that anyone may have regarding the COVID-19 vaccine. It is also thanks to you, the public, that this week we will hit the milestone of 50% of our population having received 2 doses of the vaccine and closer to community protection. Though there is still work to be done to eliminate local transmission, we are making progress thanks to the people of Bermuda for actively following public health guidelines to protect our healthcare system. The progress we are seeing and the changes that the Minister of Health was able to announce is proof that the strategy that we implemented, the sacrifices we made, and the actions that we are taking are working. In order for this progress to continue, we must stay the course. Strong protections at our borders are not ideal, but they are necessary to protect our country from dangerous variants that can threaten what we have achieved. We have seen countries around the world who were held up as examples of how to handle the coronavirus begin to re-implement restrictions, such as Singapore, who are now closing schools. The United Kingdom is considering slowing the ease of restrictions while ramping up their own vaccination program. And as we know, India remains overwhelmed and that variant is spreading. This is all due to the fear or direct impact of new variants within these countries, and a stark reminder of why protections at our border must be robust. Taiwan, which has been hailed as a success throughout the pandemic, is now experiencing its worst outbreak with 1,000 new cases in 10 days and a vaccination program that is struggling to get underway. This proves that no country is immune to the impact of the coronavirus, and governments around the world continue to make difficult decisions in the interest of protecting public health. The government has also made difficult decisions to protect Bermuda locally and at our borders. Thanks to those decisions being effective, we can now begin to look to the future and use technology to help us get there. We have used technology such as the We Health app to help notify persons of exposure and to manage outbreaks. We will now use technology again through the Safe Key program to stay one step ahead of the coronavirus to support businesses and continue to get Bermudians back to work. I am pleased to provide details regarding the rollout of our Safe Key initiative. The Safe Key will provide a secure option for allowing activities such as indoor dining and in the near future, larger events that are important to the cultural fabric of our island to be held. This is not a vaccine passport, as you do not need to get a vaccine in order to have access to the safe key or the events or activities that will be able to be accessed. Safe keys are part of our effort to upgrade our negative tests and our vaccination certificates to make them verifiable PDF documents. The certificates will contain all information necessary to verify the results of your negative tests or vaccination to another jurisdiction. The safe keys will contain only the minimum details of your initials of your name, your month and day of birth, and an expiry date. These will be used in parallel with another form of identification, such as a driver's license or passport, to verify your identity, and it does not contain information about whether you tested negative or if you're vaccinated, thus preserving your individual privacy. Both the new certificates and the safe keys contain a QR code that make the documents able to be read by an app. They contain the same data that is presented next to it, and the data is digitally signed for authenticity. The digitally signed negative test certificate and vaccination certificate will help combat concerns about certificate fraud, as these certificates will not be able to be faked. The digitally signed safe keys will make it possible to ensure that they cannot be faked when used for local purposes. The QR codes and digital signatures are developed according to the MIT PathCheck Foundation's paper verifiable credential standard. Initially, they will be verifiable by scanning them using the website verify.gov.bm on your phone, and later by any application that supports the standard. The initial rollout will be an early pilot to test how to best leverage this new technology. Persons can obtain a safety QR code by meeting one of the following criteria. First, receiving a negative coronavirus test result, and that QR code will be valid for 3 days. Or being fully immunized, and that QR code will be valid until June 15th in this initial rollout phase. As this is a new and experimental program, these expiry dates may be adjusted depending on the level of community transmission and to learn how and when best to apply them. These new certificates and safe keys will be gradually rolled out over the coming weeks. Negative test results in the coming days will be upgraded to the new certificates and include the safe key. Persons receiving a negative COVID test result by email after Thursday, so if you get a test on Thursday or after, they will include the COVID safe key QR code inside of the email of which you traditionally get right now, which also has your negative test results. Fully immunized individuals will begin receiving emails with a link where they can visit to verify their vaccination record details and be issued an upgraded certificate as well as a safe key. This initial experimental rollout will run until June 15th, and participating businesses will be able to scan the QR code and visit verify.gov.bm to verify the details and compare them against the ID of the individual to ensure that it is the correct person. The safe keys are being issued limited to just this trial period, so we can learn from the process and plan for the next phase. Vaccination safe keys will be able to be renewed for future phases. It is important to note that participating businesses will not need any special equipment in order to use the program. Only a phone with a web browser and a camera. Any iPhone, any Android, all of those phones will work. The Safe Key program is also built on open source technology so that any local company can write programs to utilize them and incorporate them in the support into their business. There are a number of local app developers who have been spoken to who will be interested in using this to help events take place. If you are a local app developer and want more information on how you can develop an app using SafeKey, please email premier@gov.bm. A successful initial pilot of SafeKey was held over the weekend, which was used for an exempted gathering of people. The initial plans for the use of SafeKey will be to allow for indoor dining to resume and for churches to increase in-person attendance for corporate worship. Using SafeKey for indoor dining will therefore allow many local businesses to reopen while we continue to eliminate local transmission. And of course, we've heard of our restaurants who are struggling, and we're happy to include them inside of this first phase. In the future, of course, safe keys may not be required for these activities if we successfully eliminate local transmission. And I think that that's an important point, because when we're planning for safe key, right now, they are to have access to events which on a broad level are restricted. But as we move to the next phase, so for instance, if we are successful in meeting the targets and moving to phase 3 with the resumption and planned indoor dining and other items, then safe key will not be required to be used for those activities. However, at this time, while we are still in a place of community transmission and we want to make sure that we are driving down and eliminating local transmission, it is important that we ensure that risks are minimized at these establishments. And that is the reason why these things are going to be implemented. The long-term view and vision for the safety program, of course, is to support larger events to take place in the future. Safety is being particularly targeted to make it possible to reopen events and will be used for the Bermuda Day event at the National Sports Center. As we gather more information of its effectiveness and the participation of individuals, we look to expand its usage to other large events in the future. It is anticipated that SafeKey will allow events such as larger weddings to take place so that couples can have their special day, no longer having to postpone during the pandemic, while knowing that we are reducing the risk of that gathering by ensuring that persons are either fully immunized or attendees have tested negative within the previous 72 days, which can serve to minimize the risk. It's important to know that you can never fully eliminate the risk, but what we're trying to do is to minimize the risk, because that's what's important to drive down and eliminate local transmission. Safe Key may also enable us to reopen local sports, as well as other indoor and outdoor activities, allowing our people to enjoy some of our national pastimes. The pilot has the potential to be a useful tool to help continue our positive trends towards eliminating local transmission and to make sure that we can continue the process of reopening our economy and allowing business to resume. It is hopeful that we will learn from the successful application of this technology so we can begin to plan for the resumption of important events like Cup Match, knowing that there is a method to reduce the risk for fans that may be attending, for staff and players alike. In keeping with sport, we are now moving to phase 3 of the return to play strategy. The government has advised Bermuda Cricket Board that training can resume, with saliva testing being administered to all players. Discussions have also begun to restart the league and county cricket, as well as holding our annual Cup Match celebration. We know that though we are looking to the future, there are still businesses and individuals affected by the current closures. I remind all individuals who cannot work that help is available, and the unemployment benefit administered through the Ministry of Finance is there to support you. You're welcome to apply online at uba.gov.bm. To businesses that have been affected by mandatory closures, please make sure you go to bedc.bm to apply for the COVID-19 emergency grants for small and medium-sized businesses. It's a reminder that these grants are there to cover the immediate costs, such as rent, utilities, social insurance, and health insurance premiums for employees, as it is important and vital that while you are still affected by closures, that support is there. The government will continue to support you and is committed to making Bermuda a more affordable place to live and do business. I was elated by the announcement from the regulatory authority that electricity rates will be reduced across all customer groups for the the second year in a row. This is keeping with the government's promises to work to reduce energy prices in Bermuda, and we are happy that Bermudian residents and businesses will benefit from us working collaboratively with the regulatory authority, the energy producer in Bermuda, and to deliver on that promise. Bermuda, we are all working hard and working collectively to move beyond this pandemic. We have outlined new guidance tonight that is only possible through our determination and togetherness to see an end to local transmission of the coronavirus and ultimately to reach our goal of an end to local restrictions. We have also announced new technology in SafeKey that will help us to stay one step ahead of the coronavirus and open up our local businesses safely. It is important to note that the SafeKey will require legislative change. Our aim is to try to get it in place this weekend, but at the latest, it will be in place by Monday, and we'll be able to make an announcement when we confirm the time that the legislative amendments will be able to be made. It is important for all of us to remember that we are preparing for the future today, and we will reclaim our summer. We will reclaim normality in Bermuda as long as we remain united in our goals and vigilant in our actions. I want to thank you for your attention, and I'm now happy to take questions from the media on behalf of the residents of the country.
Premier, we'll start with TNN. TNN, you are now live. Please ask your question.
Good evening. Premier, I've noticed that you didn't make mention of the statement on the non-vaccinated personnel, non-vaccinated travelers entering Bermuda that will be subject to quarantine for 14 days in designated facilities at their own expense. Last week, you may have mentioned that you would be consulting with the cabinet and possibly bringing changing your decision after so much pushback. No mention of it today, so it's going to stand as you stated 2 weeks ago.
Thank you, Trevor. I don't actually recall us saying that we were going to reconsider anything. I think that it's important that we focus on what it is that we're trying to deliver. And what we're trying to deliver is an end to restrictions in the country. And what is important to recognize is that we must protect our border from the entrance of new variants. The P1 variant is growing in the US, the Indian variant is growing inside the UK. We see the devastation of which these variants are causing around the world. We see that the shutdown which has happened in Trinidad, these are certainly challenging. These are things that we do not want for this country. And having gone through the experience of having lost 20 people in this, we do not want to repeat that again. The countless amount of businesses that have been interrupted, the lives of people, the education of families that are crushed by loss. And this is what happens with the introduction of new variants. So the government is determined that we want to make sure that we can move beyond the pandemic. And an important part of ensuring we do that is protect the border from new variants entering the country.
As it stands, there stands to be, it was instructed that individuals would have to pay, unvaccinated individuals would have to pay at those 3 local hotels.
There has been no change to policy, Mr. Vinci. So I'm not entirely certain what we're getting at. I mean, the fact is that we have announced a goal, and our goal is to eliminate local transition and protect our borders. That's where we are. Those are the things that were announced.
Thank you. In order for the country to recover economically, matter of fact, I was hoping that when will we might see the finance minister, because I do have some financial questions for him, but maybe if I might, I'm not sure if you can answer this, but in order for the country to recover economically, and for those persons that need support from our local banking institution, i.e. those that have loans and those that have mortgages, we understand that people are entering the second, somewhat a year and a few months of unemployment and underemployment. Has the Minister of Finance and yourself been in contact with local banking institutions to discuss assisting these individuals? Are they prepared to give to those that have loans the opportunity to someone get back on their feet? Have you been in discussion with the banking institutions, Premier?
Thank you. The first answer to your question is that the Minister of Finance will be having a press conference this week. We'll confirm the time. If it is not late this week, it'll be first thing next week. So that will certainly happen, and you members of the meeting will be welcome to put their questions towards the Minister of Finance. I think, Trevor, you would have noted that we had a broadcast which all government ministers participated in and spoke about the things in which they're engaging in. And the Minister of Finance spoke to that very topic regarding the conversation with the banks on this on these matters. So the answer to your question is that is progressive. Absolutely.
Thank you. Premier Tunian has received many calls from individuals that are waiting to receive the unemployment benefit. Despite you saying that you receive calls on your phone, as I asked 2 weeks ago, from persons that have received their unemployment benefits, we had a few individuals that had put in way back since the beginning of April and has yet received anything. And 2 individuals yesterday said that they received, after 6 weeks, $360 out of what it should have been $500 a week. Is there a shortfall, and what might you say to these individuals that haven't received any funds at all?
I don't think there's a shortfall, but if people are having an issue with the unemployment benefit, my advice would be the same as it was last week, that those persons should contact the Ministry of Finance, and they have a team up there that is certainly working.
My last question, Premier, was Dennis Pitcher interest declared as one of the owners of a company that developed the app, the COVID-19 app, especially since he is your advisor to the fintech organization?
There is no COVID-19 app, so I wouldn't go that far.
Yeah. It should be the We app. I'm sorry, my bad. The We app.
We Health, Dennis Pitcher has no involvement. Dennis Pitcher, I do not, to my knowledge, Dennis Pitcher has no involvement with We Health. So I know that Dennis Pitcher is someone who certainly advises myself on fintech matters. And when the pandemic happened, I'm happy that the country has been availed of his expertise on various issues there. But the We Health was a collaboration between the Department of IDT. There's a number of people that work in the government's information technology department. There's also a number of persons who follow you, comment, and tweet about it, who run the program, who actually did things on Burmeans talking about the work of which they did in regards to We Health. So I think your information is not correct.
Thank
Okay,
you. Thank you very much, Trevor. Premier, we will now go to Bermuda Broadcasting, Don Burgess.
Good evening. Mr. Premier, you recently cited one individual as being responsible for the latest COVID outbreak that has resulted in the deaths and the hospitalizations of too many Bermudians since March 2021. What will the consequences be for that person?
I will defer to the Minister of Health for any enforcement action which is taking place at that point in time regarding quarantine violations and or otherwise. But I know that I've heard certain questions about, whether people can be, like this can be charged for murder, et cetera. I don't think that's the case. That's the unfortunate part. But Minister, I'm not sure if you want to add anything.
I'm afraid I don't have anything else to add, Don. I don't know to what extent any enforcement actions have been taken concerning that individual. I couldn't answer that question, I'm afraid.
All right, thank you. Dr. Miller, the average recovery time period for COVID-19 cases is between 10 to 14 days in most countries. However, by our count, the average recovery window in Bermuda is now stretching past 4 weeks in some cases. Do you know what is causing the slowdown in the recovery process here? And does it mean that these infected persons have a greater opportunity to spread the virus because they currently need twice as long to recover from the infection?
Don, very interesting questions. The average recovery time, one has to calculate that with care, because in instances where we don't have the opportunity to provide good care, some of the people the very ill people wouldn't survive. The average recovery time is actually extended when we're in a position to treat the severely ill and keep them alive for a long time, and some of these recover. So that will skew the numbers to a larger number. Whereas in other instances, only those with the less severe form survive, and those are going to recover quicker than those with severe disease.
All right, thank you very much. Health Minister and or the Premier, the data suggests we've hit a soft ceiling on vaccination rates. Over the last 4 press conferences, people with 1 dose has gone from 50% to 51% to 53%, and today 53.9%. If we don't reach herd immunity, what will be the main reasons and why?
John, we will be at 50% immunization by the end of this week. We have, similar to the question that you answered last week, that you asked last week, John, we are hoping to get to herd immunity. Bermuda is not dissimilar to many other jurisdictions that have reached this soft ceiling. Those persons that were keen to be immunized were the first ones to show up and roll up their sleeves. We are now doing our best to speak to and educate individuals that may have been a little bit hesitant initially, which is why we've got the mobile clinic and all the walk-in services available. So we're making it accessible. I'd like to be optimistic. I believe we will reach herd immunity. And I'm confident that the fact that we have 50% almost of our eligible population immunized is tremendous strides. And I think we need to focus on the positive and focus on the fact that we will get there. And we will get there. And I think that, again, it's a phenomenon seen in other jurisdictions that the soft ceiling has been hit, but we will continue to strike through that ceiling so that we can reach herd immunity. And I'm confident that we will.
All right, thank you.
Don, I think it's important to note that the progress continues. The Minister of Health has said. And so the progress continues day by day. I was out on Sunday at Victor Scott today. 4 times as many people came to the East End drive-through. They came 3 weeks ago. The fact is that people are continuing to come to college, continuing to register online. It is progressing. So absolutely, would I like to, stand up and say that, we've used everything and all the rest? No, but the fact is that people have a choice and, it's a personal decision. So from our perspective, we're going to continue to provide the information. But I think it's important that you remember what the strategy that was laid out by the government is. And it's a combination of vaccinations and immunizations to reduce local transmission so the virus has more dead ends to run into, while also making sure that we enhance our protection of the border while continuing restrictions on a local basis to drive down local transmission. And I think that is the avenue for success. And all of those things are taking place. Border protections, increased immunizations, and reduce local transmission through the continued restrictions which are necessary in order to make sure that there is less of an opportunity for the virus to spread. So we are going to continue on this path. And as the Minister of Health said, I am optimistic. I'm not pessimistic. And by the time we get to the end of this month and by the time we get to next month, those numbers will be higher. And I'm sure that we'll be very close to that threshold. So, and we will see by the results of what is taking place inside the public. But right now, Don, it's important to note, 2/3, we're up to 66% of the eligible population have received at least 1 dose. That's amazing. It's 7th in the world.
53.9%. That's not 2/3.
Sorry?
It's 53.9%. That's not.
It is not 53.9%. I said the eligible population, which are those adults in the country. We are now at 66%, Don.
Okay, thank you. How many doses of the vaccine does Bermuda need to use up between now and the vaccine expiry dates at the end of June? And what will happen to the remaining doses that aren't going to be used after June 8th? Will Bermuda be sending any of the remaining doses back to the UK? Or if looks like we're going to have a large excess amount, are we going to be shipping it to another country that desperately needs vaccines?
Yes, Don, we are looking at, we have approximately 14,000 doses of Pfizer. 5,000 of those are reserved for persons that will be requiring their 2nd dose. So there's about 9,000, which represents about 5,000 arms. And with your assistance, with your publications in your Royal Gazette, you can assist us, with your with your assistance and the media's assistance, I think we can try to encourage persons to speak to their doctor and about the vaccination. So we are looking to get 5,000 more people so that we can use the Pfizer. With respect to the AstraZeneca, there are discussions ongoing right now concerning providing some of that supply to a country to the south of us, Trinidad and Tobago, who are, as you can appreciate, in need of that supply. But we are at a challenge insofar as trying to get as many people as we want to be immunized. And I say challenge with a small c, because the reality is, like I said, 50% of our eligible population, over 70% of the most vulnerable of our population have already been immunized. And I think that's tremendously great news, because of course those are our most vulnerable individuals. So we're going to continue to increase awareness, increase access. It's provided, we've got it. You can, it's accessible. All we need is for persons to roll up their sleeves and say, I'm prepared to assist in helping the community reach community immunity.
Thank you very much. Thank you all.
Thank you very much, Don. Premier, we'll now go to Island Stats. Earl Basden, you are live. Please ask your question.
Good evening, everyone. Premier, we talk about protecting the borders. Royal Caribbean will begin cruises out of Bermuda starting with vaccinated adult guests. As we have known, when vaccinated, one could still contract the virus and spread it as well. These cruises hold upward of 2,000 passengers and more than 700 crew. What contingency plans are in place for dealing with a major outbreak on one of these cruises, which could impact Bermuda?
Thank you, Don. The Ministry of Health went through an extensive exercise. Earl, my apologies. I'm so sorry. How you doing, Earl? The Ministry of Health went through an extensive exercise on this, and there's an extensive and long protocol of what is being laid out. But I think it's important for us to recognize that, guess what, Earl? I can win the lottery tomorrow, too. But just because I can win the lottery tomorrow doesn't mean that I will win the lottery tomorrow. And though it is true to say that an individual who is fully immunized can catch the COVID virus and may be able to spread it, there is a far, 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 far reduced possibility and chance of that happening. And we've seen that in effect in large scale in the United States and other places. So I think that what we're trying to make sure that we remind everyone is this is about the science, and we're dealing with it based upon the science and based upon the risk. And so I think it's important to note that our requirement for those cruises was 100% immunized passenger, with the adult passengers, the people who are eligible for the vaccine. And we have robust systems in place to address that in case there's any challenge. But we are confident in what we've laid out. And I think that it's important that instead of just repeating, oh, it's still possible to catch and transmit, as I said, it's possible to win the lottery. It doesn't mean I'm going to do it. It is far less likely with fully immunized persons, and we are seeing that. And I'm sure Dr. Miller could be able to speak to the technicalities of that more, because I think it's a very, very important distinction to make.
Will he add?
You may. It's up to him.
Yes, certainly the risk of transmission is way lower, very, very small in the immunized person as compared to others. The risk is not zero, but one of the things I've always said to people in life, that there are very few things where the risk is zero. We just have to look at a practical situation and then say, okay, where is it that there is that reasonable balance that will enable some semblance of normalcy while keeping people as safe as possible?
Okay. Premier, what allowance has been given to the cruise lines in advance for them to make their plans, while some of Bermuda's major sporting events are not granted the same leniency?
I don't know about what you say what allowance, but we've been working with the cruise lines. The Ministry of Transport's been working with the cruise lines for a very long time. So I know there was a lot of planning that went through the Ministry of Health. And when these things were announced, I almost want to say in April, I think the discussions certainly started in January. But from a local sports perspective, those things continue to progress. And so I know that we're going to be holding events, and I look forward to those events continuing, and the government's going to do everything we can to support them.
Okay, all right. What is the delay in giving the green light for Bermuda's biggest sporting event, the annual Cup Match Classic?
I won't go so far as to say the delay. I would say that they were working through the specifics, but I want everyone to know, and I know that the clubs already know, and I know that everyone knows, because this was a question I was asked way back. We want Cup Match to happen, and we will do everything that's possible. We rolled out technology today that will make it able for us to go ahead and verify. We're going to continue to do the work. And so I have no doubt that we will be able to issue the approvals that are in time that the St. George's Cricket Club has said that they need in order to plan an event. And so I am looking forward to it. And I want to continue the work on that avenue. As I said in my statement today, we are looking forward towards the future. And I think that it is important that we focus on the future. We have a tourism industry that needs to get off the ground. We have local industry that needs to get off the ground. We have local event promoters, sports people, people who rely, local vendors, all those type of persons who rely on those type of activities. And we're going to make sure that we can do what's necessary for them to happen. It's going to require the cooperation of all of us. It might not be as easy. There will certainly be bumps against the road, but I have no doubt that we'll be able to make it happen.
Okay, my final question. Is it possible for the Department of Youth and Sport to be given the authority to help sporting bodies get up and running, as it would appear that sports is continuously delayed in waiting for responses from national security?
I wouldn't go that far. I think that one of the things we're rolling out, which you'll hear more about going forward, are things with trusted establishments and others. But I think you would have heard me announce today that cricket, like I had said before, other sports will be able to advance. The Ministry of Youth, Culture, and Sport is able to advance those persons utilizing the test regimes of which we already laid out. So cricket has been given the authorization to proceeding at training, because one thing that's essential in order to have Cup Match, you have to have cricket. So we were making sure that we're doing everything that's possible so that we can enjoy the last Thursday and Friday before the first Monday in August this year.
Thank you. Thank you very much, Earl Baston. And we now go to Media Maya. Media Maya, you are now live. Please ask your questions.
Good evening, everyone. Maya Palacio here for Media Maya. My first question, a couple of people on my social feed are wondering, how does the government get the population number for Bermuda when they talk about herd immunity? Because as we know, population can definitely fluctuate, but people just want to know what source are you using directly for Bermuda's population?
Ms. Palacio, thank you so much for that question. It is a great question. It's something that we struggle with internally. And I say that because they have dynamic population projections from the United Nations, and then they have the official population projections, which are used from Bermuda, which measure the natural change in population from our last census numbers to live births and live deaths, which are reported by the Registry General, but they do not take into account immigration and emigration. So the total figures that I think were reported by the Registry General, the last figures, if I get them right off the top of my head, was I think 63,830 or something around that line. I can find the actual publication, but the publication will be on the government website. And so that is the figure which we're using. International publications use a United Nations figures, which is the dynamic projection of population, which has that figure lower at about 62,300. So we use the official figure, but if you go on an international website and when they're going at a per capita figure, they're using these dynamic figures. So if you go on to Our World in Data, for instance, or if you go to World Meters, they're using a dynamic population projection from the United Nations, which has a different projection than our official numbers. So that's a great question, and thank you for asking and allowing me to clarify.
Thank you very much. My second question is about the Safe Key initiative that you mentioned tonight. Once the Safe Key is in operation, are persons who do not use it able to still eat outdoors at restaurants?
Absolutely. And so thank you for allowing me to clarify again. Certainly, any activity which is allowed right now will be able to continue. So there's no type of things. What this is in its real use is to enable, or its long-term use is to enable larger events. So for instance, the Ministry of National Security issues an event permission or trusted establishment issues, we want to go ahead so we don't have to go through this long drawn out process of large event permissions, et cetera. It's like these are the type of things in which you need to do. Make sure everyone is who's coming to the event has done SafeKey. That means that we can verify that they're tested or immunized, just like getting on an airplane. And that can make sure that the event's risks are certainly reduced. But what we are using it for now is to try to make sure that while we're working to eliminate local transmission for things such as indoor dining, which is where we're going to start, which was not planned on coming online until we reached the milestones to move to our next phase, to possibly get some of those activities started a little bit sooner. When we move to phase 3, for instance, you will not require a SafeKey for indoor dining, perfect example. If we open up those things, you're not going to require it because that's going to be available for all, but it will most likely be used after that point in time for access to large events, as we've seen being done in other places where it have similar type programs. So I want us to make sure we clarify that. It's not to put any restrictions in place at this point in time. It is to allow us to open things where we can have reduced risk. As Dr. Miller said, you can never eliminate the risk entirely, but so you can have reduced risk in these activities to make sure that those activities will have a reduced risk of increasing any type of local transmission so that we can get more people back to work, restaurants and other things. So we'll look to see how it goes over the first week, and then we'll see whether or not we can add some more things on. But as I said, we are starting with indoor dining and also to increase the limits for corporate worship at church. So those are regular church services.
Thank you very much. And my another question that has to do with safety is, for those who do not have smartphones, how can they still utilize it? Is there any other?
That's another excellent question. I'm sorry. You would hear the sirens passing by. I've been told that my microphone is very thing. So that's a great question as well. One of the things that's important is that this is actually a paper first identity. And so when you right now, if you get a negative test, or if you get a negative test right now, and you wanted to print out that certificate to travel, you get an email with your negative test, you click the button and you print out your negative test. It's a PDF, so you can keep the PDF in your phone, or you can print it out and carry it with you. And so it is a paper credential, and all that is needed is any smartphone. It is on verify.gov.bm, and all people will have to do is to go to verify.gov.bm. It opens up the web browser in your phone. You can use, I guess, Apple people use Safari, I guess it's called. And for us, Android people, we might use Chrome. You go to the website, you just put the QR code up to it, and it will give you a check, and it will say verified. And what you do is persons will have it. It'll have, for me, it'll say DB. It'll have my day and month of birth, November 23rd. It'll have an expiry date, and I can compare that to my passport, say you are who you say you are, to make sure people aren't sharing and all the rest. The restaurants and the rules that'll be laid out by the Ministry of Health is that people need to check a form of ID combined with this, and then those persons are able to be admitted to those type of things of which we're doing. So yes, it is a paper credential, but you are able to put it inside of your phone with a PDF. In the future, what I said in regards to local app developers, I mean, there's someone who's working with us who is part of the Code 441 bootcamp that we had a while ago, who's building an app. I know there's a local fintech company who's building an app. I reached out to someone else the other day who's interested in building something, and someone else reached out to me to say they want to be a part of it because they heard when the unfortunate premature announcement went out last week, Friday. So from that perspective, anyone will be able to build an app, so you may not have to keep it in your, have a paper credential, but it is a paper first credential. It is very simple, and we're just trying to make it as simple as possible where someone can have a piece of paper and any smartphone can verify it. So it could even go to the place that you yourself may, say you want to have a gathering when maybe the size limits go up to 25. You yourself could be an individual and you say, I'm hosting the event at my house, but I just want to make sure that, we're keeping, reducing the risk and keeping COVID safe. I'll just be scanning your SafeKey when you come in, and you can, because anyone can do it. You can literally just go to verified.gov.bm and go ahead and scan it. And it's completely private. So if you manage to lose this piece of paper, no one will be able to, get your information, get your date of birth, get your name and all that stuff, because it does not have all that information on the sheet. So it's to preserve your privacy, but it's also to make it completely open for anyone to use.
Thank you very much. My final question goes to the Minister of Health, Minister Kim Wilson. question. Tonight you mentioned that those who are close contact will no longer have to quarantine but can still go to work. So my question is, what guidelines or sources led to the making of that decision?
Thank you, Maya. Just to clarify, that relates specifically to the guidance as it relates to immunized persons. So an immunized person who has been identified as a close contact is able to continue going to work provided that they continue wearing their a mask and so forth, provided that they don't have symptoms. So the proviso is, of course, if they are not symptomatic. And part of that, the rationale behind that, we had quite a lot of discussions here at Health, and the CMO, the Chief Medical Officer, was satisfied that with respect to easing of some of the restrictions for persons that are immunized in circumstances where controls could be in place, such as the employer, returning to employment in those circumstances. But as I mentioned also, Maya, it does depend on the circumstances. Some high-risk places, such as perhaps corrections or healthcare facilities, may have extra guidelines that they're going to be imposing on those individuals. So these are general guidelines for persons that are immunized that are returning to work, ensuring that they have like workforce isolation, i.e. they don't eat with other people, they continue to have their masks and so forth. But again, the qualifier is subject to them having no symptoms. And then of course they test.
Thank you very much.
Thank you, Maya.
Thank you very much. And we will now go to the Royal Gazette. Royal Gazette, you are now live. Please ask your questions.
Good afternoon, Owen Johnson Barnes with the Royal Gazette. First of all, this is more suited to the Minister of Finance, who obviously isn't present today, but I should probably still put it forward anyway. Do we have any idea how many people have applied for financial aid during this most recent spike of cases, and how many of those have been paid or will be paid?
Thank you. And I did give, I think, figures on that when I spoke the last time. If it wasn't last week, Thursday, it was the Thursday before. But as I indicated, the Minister of Finance will be holding a press conference. He was out on leave last week, but he'll be hosting a press conference. So as I said, it'll either be late this week or early next week, where he can provide any answers to those questions. So you can stay tuned at that time. But I did report figures. I don't know what they off the top of my head, but if you want to refer to I guess it was either last Thursday or the Thursday before, where I had given some outline of the amounts that have been paid. You can find it there.
All right, thank you. Next question. Pfizer has stated that a booster shot may be needed for those who've been vaccinated within 12 months. Is government planning to get those vaccines from the UK? Is that still going to be at free for us, or will that come at a cost to government?
Thank you, Owen. Those discussions we are having, but certainly if a booster is made available or required by Pfizer, we will certainly source it. We would perhaps obviously consider our options as it relates to further utilizing the United Kingdom sources, as they're supplying all the OTCs. So presumably if they're supplying with Pfizer, if a booster is made available and required, then they would also assist with respect to acquisition of that for their OTCs.
Now, earlier today in this press conference, you mentioned that there's going to be a slight change in policy for those who are vaccinated versus who are unvaccinated when it comes to mask wearing. People are wondering how that is going to be monitored. Are people going to be expected to prove that their vaccination status or recent test results when they're just out in public?
Thank you, Owen. That question that you can appreciate is a phenomenon that other jurisdictions worldwide, America in particular, is grappling with insofar as the enforceability of that. The messaging is quite important. What we're indicating is that if you are immunized and those circumstances exist where you're outdoors and ones that I relate to you and you're with other immunized persons and so forth, then you are not required to wear a mask. The proof, as you indicated, is challenging because your vaccine status is your private status, that's your private medical status. So I can't be forced to produce that information to anybody. So part of it is going to be about communication and making sure that people recognize the safest thing really is to continue to wear a mask, right? If you're not immunized, then the next best precaution for catching COVID is through protecting yourself through masks. So we're going to have to continue with that messaging and recognizing if you're still in a closed-in space or if you're in a vulnerable individual, then you should still protect yourself and continue to wear masks. So part of it will be the messaging, and we need to make sure that persons understand that the wearing of a mask is still a very, very important preventative tool that you can use to protect yourself and others.
And I think it's important, Owen, to remember that the minister had said that this is guidance. And a lot of this is about, relying on individuals to make their own decisions and to talk about what is safe and what is not safe. So when the minister had pointed to, with your indoor gatherings with, all immunized people, those are safe things. No one's going to come into your house and to your home and all the rest. That's not the way that this is. But what is important is so that people can understand. I mean, we've been living through, 14 months of, a lot of where we've seen families lose each other, and people want to make sure that they can do what is necessary in order to be safe. And so the guidance of which is being put out is from the government and from the Ministry of Health. So they can say, these are the type of things where you can, be safe. And this is a safe environment. But we still have community transmission. There are still unlinked cases that are being reported, that we still, it is still important that we keep those protections. But I think it's important, as we recognize the theme of what I spoke about today is looking forward towards the future, that we're making progress. And we're at a place now where 50% of the total population would have had 2 doses by the end of the week. That is in, as I said, top 7 in the world. It is a good place to be. And so it is a time now that we can say, these are the type of things of which you can do. It is not as though if, there's going to be police around trying to check and all the rest. That's not the way it is. But we are moving to a place that is going forward, and we're going to trust our people to go ahead and do and make the decisions necessary to certainly protect themselves. But the Minister of Health did not say that if you're going to go in a grocery store, you can't wear a mask. That's not what we're doing. When you're going to those indoor places, all those things will still be legislated, because it's important, as we have a situation with community transmission, that those indoor spaces, public indoor spaces that are able to be accessed by people are able to be protected.
Now, Premier, you also earlier mentioned the Safe Key program. Can you give us a little bit more information? Who is the operator who will be running this initiative, and what will the cost be to the taxpayer, if that has been decided or worked out yet?
The operator who's run the initiative, no operators run the initiative. The vaccine certificates have been upgraded by the vendor who works on the vaccine certificates. That was advertised in your newspaper, ResQuest, but that's just adding the QR code certificates. The actual program itself, verified.gov.bm, is being hosted on the government server, and it is free. So the only thing that is actually about this is right now we issue paper certificates, and the only change is that the paper certificates will have a QR code on them, and there is a place where people go on a government website to go ahead and scan. Private developers are going to be able to develop their own apps based upon this protocol. As I said, it's from the MIT Safe Path protocol, I think, which is freely available on GitHub. I'm sorry, I'm an IT guy, so I can talk about this stuff. So it's available for people to use. So I think it's important for people to recognize what has been done here. We issue certificates. This is about the upgrading of the certificates, of which we already issued, to add a QR code to them. And that QR code itself, which is already emailed to people or which people can access, is now being able to scan by going to the government website, verified.gov.bm, and go ahead and use it. It is simple and free. So as I said, if you wanted to have a party in phase 3 and you wanted to have 25 people over your house, and you wanted to just make sure that people, were, as you say, to reduce your risk and have a safe key, they can get it, and you can literally bring up your phone and just scan, and it'll give you a check mark. It is lightweight, it is free, it is universal, and so it is not going to cost any restaurant or anyone any money in which to use.
Thank you very much.
Thank you very much. Premier, there are no further questions from the media.
Thank you very much, Director Wilson. I want to thank the Chief of Staff for the hospital, Dr. Wesley Miller. I'm certain that your staff is certainly relieved, that there is certainly less stress and pressure on your staff there, who did incredible work over the last few months. So I want to thank you and your staff on behalf of the people of Bermuda. Minister of Health, certainly thank you for your attendance today. I know that it's been a long slog over the Ministry of Health, but certainly the news that you've released today is certainly hope for a bright future. And I want to thank the people of Bermuda for listening to what we've presented this evening. And feel free, of course, as always, to share your questions. There'll be more information that is going to come in regards to SafeKey, certainly on how businesses and churches can be involved in the initial stages, and more information to be released soon. But this is an exciting time. We are progressing and we can look forward to the future. I want to remind everyone to please continue to do your part to observe public health guidelines, speak to your doctor to make an informed decision about the COVID-19 vaccine, and together as a country, we will certainly move beyond this pandemic. So thank you, Bermuda, and good night.